Michelle here. I'm going to tell you a little bit about my immigrant interview that I was able to do. I was able to interview one of my really good friends. Her name is Gabby. She is from Brazil. She moved here when she was 12 years old with her family. So both of her parents are Brazilian. They grew up in Brazil, and she has 3 siblings that are all older than her. And so they moved here when she was 12 years old. And the primary language in Brazil is Portuguese, so that is her first language and her parents' first language. And they actually moved to America. It was a 1-year plan for her dad to come here and learn English better so that he could take that skill and go back to Brazil and be able to speak English better. But after living here for a year, they loved it and they stayed. They were very impressed with the school that the kids were in, the education that they were getting. They were very impressed with how clean it was. They moved to Colorado. They lived in Highlands Ranch. So they were very impressed with how clean it was compared to where they lived in Brazil, which was near Rio. And then they're also very impressed with how safe it is here. They didn't really realize how unsafe they were living in Brazil was until they had something to compare it to when they lived in America. So they ended up staying. So they've lived here ever since. So she grew up from age 12 and on here in America. So I was able to talk to her. Her parents are actually in Brazil. They've been there for the past few weeks visiting family. So I wasn't able to face-to-face interview them, but she was able to call them and get some of my questions answered for the purposes of this assignment. So in Brazil, they have a free healthcare system that the government has put on, that anyone can go and get free healthcare, free doctor checkups, free surgeries, free whatever you need is covered by the government. And then about 20% of Brazilians have private health insurance, similar to what we have in America. Now, the differences between these two things is the people with private health insurance see different doctors, kind of similar to here in America and like Medicare doctors. And so the free healthcare system, they kind of described as just a mess. There's not enough doctors to provide for all the healthcare needs of the country. And the doctors that are there, some of them are great, but some of them really aren't that great. And people who need to use it will go to these clinics, and they'll stand in line for hours and even days sometimes to receive health care. An example is her cousin went when he was about 20 years old. He was having some pain when he was going to the bathroom. So he went and stood in line at one of the clinics for 8 hours, went in, talked to a doctor. It was more of a sitting across, the desk, talking to the doctor, told him his symptoms, told him what was going on. The doctor didn't do an exam, didn't even take a look or anything, and told this person that he would need surgery and that they would schedule it, but they were booking about 6 months out for that surgery. And so he scheduled the surgery, left. Come to find out, he had just had a case of hemorrhoids. They actually ended up going away, but could have been solved with just a simple cream. So that kind of gives you an example or an idea of what those healthcare clinics are like in Brazil, which is really unfortunate. And all the doctors might not be that way, but, it just gives you an idea that, they didn't even really do an exam, scheduled one that he just wanted to do the surgery. And, so not super ideal. But her family did have private health insurance when they were there. So if they ever needed healthcare, they would just go to a doctor. Actually very similar to how it is in America. She said one of the big differences is that it's very American to go in and get preventive, like healthcare screenings, your checkups, dental visits, and all that. More in Brazil, it's more you just go if you're sick and can't get better, can't figure out how to get better, or you don't know how to get better. So she said her parents, while they've lived in America and while they have had insurance, they very rarely will go to the doctor just because of that mentality. They don't really think that they need to get preventative checkups and everything. Whereas she, now 30 years old, she's married to an American and has 2 kids. She's just very typical. She goes and they get their regular annual checkups, they get their dental cleanings and checkups and everything. So living very much so, just kind of normal. Her ideals are just, you know, she tries not to go to the doctor if she doesn't need to. She'll try to just avoid medication if she can. She says she doesn't know if that's a Brazilian tradition or just how she is, but she'll just try to, you know, do like warm honey teas or something when she's sick, unless she actually needs like an antibiotic or something. Then she'll go get in and get checked by the doctor. So yeah, that kind of just sums up everything that we were able to talk about with her and her family. I was kind of hoping to learn a little bit, not learn, but thinking that they might have different cultures and traditions in Brazil. And maybe some of the more tribal areas do have different customs and everything, but otherwise, her and her family have a very American way of thinking as far as Western, you know, they utilize Western medicine if needed. They don't have a whole lot of holistic techniques, and she said a lot of the people they lived with in Brazil didn't either. So yeah, that's it.